How can you tell a focal seizure from another medical event? Imagine seeing someone suddenly twitch on one side of their body, or hearing them make repetitive movements like lip smacking or picking at their clothes. These signs can be clues that a person is experiencing a focal seizure. Focal seizures start from abnormal electrical activity in a specific part of one brain hemisphere. Because of this, the symptoms often appear localized and can include movements affecting just one limb or one side of the face. Sometimes, people have sensory or experiential sensations before the seizure begins. These are called auras and might include feelings of fear, déjà vu, or jamais vu, which is a strange feeling of unfamiliarity. Others might experience unusual sensations like tingling, visual disturbances, or sounds that seem out of place. During a focal seizure, awareness can be affected. The person might stare blankly or seem unaware of what's happening around them. They may not remember the event afterward. After the seizure, some individuals experience temporary weakness or speech difficulties, known as TOD paralysis or aphasia, which can help distinguish a focal seizure from other events. Now, other medical events can sometimes look like focal seizures but are actually different. For example, transient ischemic attacks, or mini-strokes, cause sudden neurological symptoms that resolve quickly but usually lack the stereotyped movements or aura seen in seizures. Migraines with aura can cause sensory disturbances like flashing lights or tingling, but these tend to last longer and are followed by a headache. Psychogenic non-epileptic seizures, which are not caused by electrical brain activity, can mimic seizures but often lack the typical electrical patterns seen on an EEG. Other conditions like movement disorders, fainting, or hallucinations may also look similar but usually have different patterns and signs. To tell a focal seizure apart from these other events, healthcare providers relying on a combination of information. They start with a detailed medical history and eyewitness accounts to look for typical seizure signs and triggers. A neurological exam can reveal focal deficits or unusual signs. An electroencephalogram, or EEG, records brain activity and can show abnormal discharges in specific areas during or between seizures. Imaging tests like MRI or CORT scans help identify structural brain issues that might cause seizures or mimic them. Sometimes, additional tests like blood work or long-term video EEG monitoring are needed to confirm the diagnosis. Recognizing a focal seizure early is important for safety and proper treatment. During a focal seizure, safety measures include protecting the person from injury, keeping their airway clear, and staying with them until the seizure ends. Unlike generalized seizures that involve convulsions and loss of consciousness, focal seizures may be subtle and not cause complete unconsciousness. That's why paying attention to small signs like lip smacking, unusual sensations, or brief staring episodes is key for caregivers and responders. In summary, distinguishing a focal seizure from other medical events involves noticing specific localized symptoms, changes in awareness, and supporting diagnostic tests. It's also essential to rule out other conditions that can look similar. This comprehensive approach helps ensure accurate diagnosis and guides appropriate seizure, first aid, and management. If you suspect someone is having a seizure, always seek medical advice to get a proper evaluation and personalized care.